Hello, Dr. Kevin. Welcome back. It's good to see you again. Kevin, I have good news for you. You've done the right thing by coming in. I reviewed your exam findings, and I'm confident that what you have is treatable with chiropractic care. Because you have a chiropractic problem, I want you to know some important facts about chiropractic. First of all, chiropractic is not new. It's not experimental. Chiropractic has been the successful treatment of choice for conditions like yours for more than 100 years. In fact, if it weren't so successful, it would have disappeared years ago. But instead, the opposite is true. Chiropractic is the second largest healthcare profession in the Western world. According to an WebMD study, over multiples of years, close to 2 million patients, WebMD has concluded that chiropractic enjoys a 95% patient satisfaction rate. So you can be assured that you did the right thing by coming in here for the solution to your problem. So now let's talk about why are you here? Why do you feel this way? Why are you having this pain? First of all, it wasn't any one thing that you did. It wasn't one twist or one turn that caused the problem. Your condition didn't start the day the pain started. Your condition has been developing over time. The cause is the accumulation of multiple impacts to your skeletal system. It starts with the physical trauma of being born, and it continues with all the hundreds of falls and spills you've had as a child and as a teenager. Just think about the number of times you fell when you were learning how to walk. If we were to consider your current lifestyle, it would be impossible to know the number of improper lifting, twisting, bending moves that your spine endures every single day. And that's why I say it's not any one event that caused a problem. Your spine has suffered years of being pushed and pulled out of alignment. So what happens is pressure to the discs squeezes them close together and eventually irritates the nerves that exit between the spine. Your nerves are being pinched and therefore compromised from performing their natural function of communicating to the rest of the body. If you don't have proper function, you can't have proper healing. It's absolutely fascinating. So what happens is the nerves come down from the brainstem, they come down the spine, and they exit each level, and these nerves provide information to every single organ, muscle, and joint in the body. Without the proper nerve flow, you can't have proper function. Misalignments cause more than neck and back pain. Misalignments can cause a variety of diseases. Have you ever been watering the garden or watering washing the car and had a kink in the hose? And what happens? So when there's a kink in the hose, you don't have water flow, and you've experienced that. Well, the same way, when there's a pinching of the nerves, you're not going to have proper nerve flow to your organs, and eventually you can have a variety of diseases besides neck and back pain. They're like any disease in your body. The longer it's in your body, the worse it can get without any kind of intervention. So, based on your exam findings, I place you in phase 2. It's so important for us to start treating, because with proper care, we can prevent you from progressing to phase 3 or phase 4. All right, so hopefully I have described exactly what's going on in your body and why you're having this pain. So now let's move on to the next part, the part that you probably care more about, the solution. The solution is a series of treatments that we call adjustments. And the purpose of the adjustment is to retrain the spine into its proper alignment. When the spine is in its proper alignment, there is no pinching of the nerves, and your body can then function the way it's meant to, so you can heal. As with an orthodontist who goes into your mouth to align your teeth in their proper position, it doesn't happen in one visit. It takes a series of visits over time that will bring the teeth into their proper alignment. And then that's what I'll be doing here for your spine. I will adjust your spine, and over time it will accept the new alignment. But you have to know that you have been out of alignment for a very long time. So your body considers the current alignment to be normal. And so it's going to be a process, 3 steps forward, 2 steps backwards. But in time, your body will accept the new alignment because each visit builds on the one before. And what I will be doing is I will be retraining your spine to accept the new alignment. So it's important that you attend all your appointments, and that way you can see progress. There are 3 stages to your care. Stage 1 is probably the one that you care most about, getting out of pain. And I care about that too. So my goal is to help you get out of pain as quickly as possible. Based on my experience with other patients over the years, I expect that you will need to come in 3 times a week for 4 weeks. At the end of the 4 weeks, I expect you're going to be feeling pretty good. You'll be out of pain, and you'll probably think, okay, you got what you wanted, you're all set. But I have to caution you, at the end of phase 1, it's just the beginning, because if I don't have you stabilized, you're at a very vulnerable position. You can go right back into phase 1 at the beginning and be the way you are right now. So what we need to do is train your spine to hold the alignment, not just to be out of pain. So we need to stabilize it, and that's stage 2, but stage 2 is easier for you. So what happens in stage 2 is you come in twice a week for the next 4 weeks. To make sure that it's appropriate to graduate you to stage 2, at the end of stage 1, I'll be doing a short progress exam to make sure it's time for you to move on to stage 2. So stage 2 is the stabilization phase of care, and it's the most important part of the care. Stage 3 is the best part of care, because you're not going to stop doing the activities that you do that have brought you here to begin with. And so now, instead of letting those activities wear you down until you can't move, we're going to maintain the progress you've had at the end of stage 1 and 2. But we'll talk about that when the time comes. So, wellness is what you need. Wellness is what I can provide. Let's get started. I'll treat you today, and before you leave the office, you'll need to stop at the front desk and schedule all of your stage 1 and stage 2 appointments with Kylie, so you can schedule your other activities around your appointments here. So there's 2 things that you need to do. You'll need to schedule your appointments, and you'll need to schedule your attendance at a short and sweet talk that I give. It's called How to Stay Young, the First 100 Years. I promise you, it's information that you haven't heard before, and it's very important to your future health and well-being. In fact, it's so important, your friends and family will benefit as well. So if you could bring them in with you, they will learn things that will help them for their future health. All right, let's get started.